Well, hello, and welcome to Module 14. During this module, we will be discussing pediatric genitourinary disorders, or those that affect the genitals or the urinary tract. So some of the disorders that we will be discussing include urinary tract infections, so common, not as common as in adults, but we do see them in children, mainly girls. Vesicoureteral reflux, or VUR, and that's kidney reflux. That's where the urine is refluxing back up towards the kidneys. Normally the urine is formed in the kidneys, go down the ureters to the bladder and out the urethra. But in VUR, this kidney reflux, the urine refluxes backwards up to the kidneys and can cause a lot of damage. We'll also be talking about glomerulonephritis, which is an acute inflammation of the kidney, usually caused by an immune response. Nephrotic syndrome, or a kidney disorder that causes your body to excrete too much protein. Renal failure. Cryptorchidism, and that is where one or both of the testes have failed to descend out from the abdomen into the scrotum. Hydrocele, and that's where fluid collects around the testes. And uresis, which is bedwetting. And hypospadias, which is an opening of the urethra on the underside of the penis. So when caring for children with genitourinary dysfunction, it's very important for the pediatric nurse to assess the child's fluid and electrolyte status. So first, nurses must know how to assess for dehydration. So how would you know if a baby was dehydrated? Well, you may notice a lack of tears when they cry for an older infant or toddler. You may notice dry lips, sunken eyes, sunken fontanelle, the soft spot on the top of their head. If it's sunken, that may mean that they have fluid depletion. Decreased number of wet diapers, or not urinating as much. Irritability, restlessness, and if they're very dehydrated, lethargy. So infants and children have a higher percentage of body water content than adults do. So they have a higher metabolic rate, and they have increased body surface area to mass index. So this total body water comprises about 70% of body weight in infants, compared to only 60% in adults. So infants and children require proportionately greater volumes of water than adults to maintain their fluid status, and are more susceptible to volume depletion. Now, adults that are dehydrated may be able to wait in an emergency department until a bed becomes available, but an infant that is dehydrated can go down the tubes really quickly. So we need to have nurses that know how to assess for dehydration, and when there's alteration in fluid and electrolyte status is happening in an infant, these babies need to be seen quick. So when completing the module, think about ways in which the pediatric nurse needs to assess, care for, and manage the different genitourinary disorders in the pediatric population.